I'm joined now by a friend of the show, Dr. Jen Caudle, family physician and associate professor at Rowan University. Doctor, welcome back. We now know from the White House doctor that President Trump has received an experimental antibody cocktail. So, Dr. Caudle, with this treatment, what does this tell you about this case?
Well, there's still a lot of questions. There's a lot that we still have yet to learn. We have received reports that he is experiencing some symptoms. I think we will hopefully learn more about the symptoms he's experiencing as time goes on. But this antibody cocktail, the intent, it's an experimental therapy, and the intent is to sort of bolster a person's immune system. That's what the intent is. So, I think as details come out, information comes out, we will learn more, Hannah.
We don't know about President Trump's medical history. What we do know is he is 74 years old. He is overweight, which are both risk factors for the virus, as you know very well, Dr. Caudle. So with this knowledge, what can you tell us about how doctors would treat a patient like this?
Well, certainly with any patient with COVID-19 that's been diagnosed, vigilance is really important. We know that symptoms can take anywhere from 2 to 14 days after exposure to actually develop. We also know, Hannah, that symptoms may start one way, or sometimes people may even start without symptoms, and then those symptoms can worsen over time. So, one of the things that we're going to be looking out for, and his doctors and his medical team certainly are going to be on the lookout for, is, how his symptoms change, if at all, how they improve, what they do, in other words. So he's going to need close monitoring. It seems as though he has some symptoms now, exactly what they are. Hopefully we'll get more details about that. But one of the keys is going to be to make sure that he doesn't get worse, or if he does, that we certainly know that, or on top of that, they're monitoring that closely. And what I mean by that is things like breathing, difficulty breathing, shortness of breath, other signs of deterioration.
We've been talking about remdesivir and dexamethasone for weeks now. Could these be treatment options available to the president?
Well, so I think it really depends. We think about remdesivir, we think about dexamethasone, even convalescent plasma are treatments that may be used in certain situations with certain patients with certain types of COVID-19 illness or disease. The question is, has he reached the point where those are options or would be reasonable? And again, his medical team knows what's going on with him better than anyone else at this point. But certainly we know that those things have been used and are used in other places, other hospitals throughout the country with certain patients. So, I think, right now, understanding, I think for the public, for us to all understand what the different options are, different treatment options. But again, not every COVID patient is a candidate for any and all of these treatments. Some of them are recommended for those with only severe illness, etc. So again, his clinical course is really going to dictate what he gets, what he receives, and why.
We know the president has often resisted wearing a mask. There are so many images of him out there meeting people, coming in close contact with many, many Americans. Should these people who've come in contact with the president in the last few weeks, last few days, should they be concerned, get tested, quarantine? What's the next step for them? Yeah,
all of the above. Quite honestly, all of the above, Hannah, you're exactly right. And if I can just make a statement about the mask wearing, there's a number of people who don't feel that masks are important, or there are even people who still don't believe COVID-19 is a real thing. We wish Melania and President Trump well. We hope for a speedy recovery, and the likelihood statistically is that will happen, right? But what I'm hoping is that this gets the message across to everyone that we do need to be wearing masks, socially distancing, etc., and that yes, this is a real condition. To your point, however, about what the others should be doing, if they've had exposure to the president or to Hope Hicks or anyone else that's sort of in that bubble, yes, they should be all of the above, tested, quarantined, all of that stuff to try to isolate them from other people and to wait it out to see if they develop symptoms.
President Trump and Joe Biden, of course, debated on Tuesday. To be exact, they were 12 feet and 8 inches apart, but obviously they were an inside venue. There was a lot of yelling going on. When you look at these pictures, we know now that President Trump did have the virus at that point. But even with a negative test that Vice President Biden had today, should Mr. Biden be concerned?
Well, this is the thing. That's a really good question. It's also a question that we can't say, with 100% certainty, right? Because it depends on so many variables. Yes, the fact that they were even in the same sort of vicinity is something that will raise sort of a question mark. They weren't wearing masks when they were debating, obviously, because they were debating. They were 12 feet away, but we don't know what, say, happened behind the scenes, backstage, when they arrived, etc. I think, the most important thing is that testing happens, and those candidates are, Biden, et cetera, is very vigilant about symptoms, wears masks and things like that. I should also say, though, testing negative today doesn't mean you will be negative tomorrow. So, and that's not just for Biden, that's for anybody. You know, things can certainly change on a dime. So I think that's really important to keep in mind. But, you know, was he in the environment? Sure. Was he 12 feet away? Which, yes, that's great. I should define, the CDC defines sort of close contact as being within 6 feet for at least 15 minutes or longer. So you kind of slice that up and dice that up and sort of see where you come out. Again, it's going to depend on a number of variables.
We have talked about the need for contact tracing when someone tests positive, but Dr. Caudle, how do you contact trace someone who's been in 4 states plus the District of Columbia just in the last week?
Right, this is tough. Now, this one is going to be tough. This is no small feat. You know, my heart goes out to those contact tracers, but I'm really thankful for the work that they're going to do and are doing likely right now as we speak. You know, all of the potential contacts need to be contacted and need to be notified, and proper precautions need to be had. But this is the importance of contact tracing, is to try to find contacts of those who might have been exposed to somebody with COVID-19 and to isolate them. But I would take a step back. This is why we as Americans need to be wearing our masks and social distancing and staying away from groups and washing our hands and stuff like this, because we hope not to be in situations like this, right? We hope that this doesn't happen. So, you know, once again, I think there are a lot of sort of important reminders that we're getting from this situation. Of course, we want the president and his wife to recover speedily and very quickly. Of course, the other people in the White House vicinity that are coming up positive as well.
We always appreciate your insight on such an important subject. Dr. Jen Caudle, family physician and associate professor at Rowan University. Always appreciate your time, doctor. Thank you so much.